amendment, Chairman. Just this holiday weekend, there were multiple shootings and stabbings in my ward. A young honor roll student died, and 3 others were sent to the hospital in one of the incidents. A few hours later, there were several other shootings. Just yesterday, there were 7 people shot yesterday. We're in a situation where it's life and death for a lot of residents east of Anacostia River, and so the hospital conversation is a priority for us. While we are anticipating a brand new facility coming to the East End hospital, we are not in favor of slashing funds at this time so that the hospital can be inoperable. We want to support the nurses that are there, the staff that are there, and leave the confidence that we still believe in giving high quality service to the residents of the District of Columbia. The hospital currently provides emergency, behavioral health, long-term nursing, surgical, and other services to residents of Ward 7 and 8. It is important to highlight that there has been significant pushback by hospital stakeholders regarding the patient count that was cited by the Committee on Health. The stakeholders assert a full daily total of 503, upwards of 400 patients from a number cited by the Committee on Health. The Committee on Health's numbers does not include patients seen in the emergency room, in behavioral health, and in other skilled nursing facilities. It is almost 300 patients not counted. While the council is correct in focus on maintaining the fiscal health of the hospital, which I think we should do, our focus should be on determining the level of funding that is necessary for UMC to remain a viable health option for residents east of the Anacostia River. Because what I do know that on Sunday, when I arrived to the scene at approximately 11 a.m. after a known shooting had occurred, a woman who was driving a car drove her car to the nearest closer hospital, and that was United Medical Center. While I'm not sure that $40 million is the exact number, my staff witnessed that $25 million was taken from it. While we didn't want to take money from places that we felt like that was needed, that was suggested by Councilmember Gray, there are some areas that we did focus on to ensure that we put some money back. And that total amount was $3,140,839, which is still a drop in the bucket when we talk about a healthcare system east of Anacostia River. We cannot say as a council that we are working to provide equity to our residents by completely cutting services as a method to get a new hospital. Supporting this amendment shows you care enough to provide services to residents living east of the Anacostia River and in hopes to build a new hospital. We need to ensure that the new hospital will have a full range of services to include a trauma unit and not a glorified clinic, but that's another conversation. Another 30 seconds, Chairman.
Without objection.
Restoring funding, well, a portion of the funding is what's proposed to UMC is a belief that residents in Ward 7 and 8 matters and their lives are important. I encourage my colleagues to support this amendment.
Councilmember Trayon White?
Yes, thank you. I do want to say this because one of the narratives is that the hospital is not closing, but it's equivalent to taking the oxygen out of somebody's body and putting them on life support. It will not be able to function at minimum capacity, taking $25 million from the budget. And what we've done, the narrative is also that I cut money from these different programs. I didn't cut anything. I restored the money that was cut to the hospital. So the money was already in the hospital for $40 million, and it was cut. And so what I did was try to do my due diligence to find things that we can put back in, because when I have to go, I was born there, so I have a personal feeling towards this particular hospital. I live about 45 steps from this hospital, and I know that residents in Ward 8, and Ward 7 use this hospital on a daily basis, because some of them don't have the money to travel across the city. And as we saw from a lady who suffered a gunshot wound, with a 9-year-old in the back passenger seat suffering from a bullet wound, her daughter in the other seat suffering from 3 shots, she drove to this hospital. So picture if she had to take that same ride to Upper Northwest in her car, already wounded herself. We have to look at the life and death of the decisions we are making. And this is a drop in the bucket to restore some funding to this. And so I don't see what the whining and crying is about when we're saying, we're talking about $25 million that was split up all these different areas. Are they good causes? Yes, they are. But at the expense of residents who have to go to this hospital every day. We have living people in the hospital right now that's in a bed, in the emergency room right now that need services. So if we move the doctors, the nurses, the staff, and the faith in this hospital is dead. I urge my colleagues to support this amendment. And I move to a vote and a roll call, Chairman. I ask to close the vote and I ask for a roll call, Chairman.
I appreciate the timely request. Is there further discussion?
Mr. Chairman.
Councilmember Silverman, second round.
Thank you, Mr. Chairman. Let me read from a letter that the Chief of Staff from UMC wrote to all of us. She wrote, eliminating inpatient services at UMC before the new hospital is ready to accept patients would be a grave disservice to the residents of Ward 7 and 8 and will deprive them of their last access to inpatient hospital services east of the Anacostia River. I'm not good at my computer. Basically, she says further increasing the racial and economic divide in our city. That is what is at stake. I just want to be very clear about what we are doing. So we are negotiating for an operator for a new hospital. We do not have an agreement right now. So once again, what does everyone agree on? We agree that we need a state-of-the-art healthcare system and hospital on the east side in Ward 7 and 8. So the issue is not about building the new hospital. The issue is about making sure we have hospital services that are going to meet the needs of our residents until that new hospital is built. That is the issue. And I will say once again, and this is what is so demoralizing today, is we are pitting residents against each other. You know, no, that is not what we need to be doing. Here's what we need to be doing. We need to ensure, and yes, we have an operator who is fiscally irresponsible at UMC, but our residents and their health should not suffer for it. We should do the necessary things we need to do in order to deliver services, and we have a date on paper right now when that new hospital is going to open, but we actually don't know when that new hospital is going to open. But what we are doing is depriving, as my colleague said, that hospital of resources in order to take care of patients safely. So I am going to support this amendment. I know that this is not where we should be again, but we need to make sure that we have hospital services in the interim until this new hospital is built. Thank you, Mr. Chairman.
Thank you. If there's no further discussion, we have the
Thanks for a
amendment
roll call, Chairman.
before us. Roll call. Madam Secretary, please call the roll.
Councilmember McDuffie.
I'm going to vote for the amendment. I'm voting yes. I'm voting with the folks at the hospital.
Councilmember McDuffie votes yes. Chairman Mendelson.
No.
Chairman Mendelson votes no. Councilmember Nadeau. Yes. Councilmember Nadeau votes yes. Councilmember Silverman.
Yes.
Councilmember Silverman votes yes. Councilmember Todd.
Yes.
Councilmember Todd votes yes. Councilmember Robert White.
Yes.
Councilmember Robert White votes yes. Councilmember Trayon White.
Yes, yes.
Councilmember Trayon White votes yes. Councilmember Allen.
Yes.
Councilmember Allen votes yes. Councilmember Bonds. Yes. Councilmember Bonds votes yes. Councilmember Che.
Present.
Councilmember Che is recorded as present. Councilmember Evans. Councilmember Evans votes yes. Councilmember Gray.
No.
Councilmember Gray votes no. And Councilmember Grasso. Councilmember Grasso votes yes. Mr. Chairman, there are 10 yeses, 2 noes, and 1 present.